we need to move on. And the next speaker is Professor Abdelmaaboud Shaymaa from Bahrain, with a lecture of focus on combined impact of obesity, diabetes, and cardiovascular disease, prevention and management.
So next year, inshallah. Welcome all. I'm happy to be in the conference, and thanks for the invitation from Dr. Ines Shaltout. Successful Congress every year, AASD. Today we will discuss about focus on combined impact of diabetes, obesity, and cardiovascular diseases, prevention and management. I'm Dr. Shaymaa Abdelmaaboud MD Cardiology and Assistant Lecturer at NHI Giza, and a senior cardiologist at Al Salam Specialist Hospital, Bahrain. As we know that obesity is global threat waiting area. The Lancet article that there is global, regional, and national prevalence of overweight and obesity in children and adults during period of 1980 to 2013. And without any shade of doubt, the biggest and the more powerful study describing the current prevalence of obesity worldwide in adults and in children, as well as the prevalence has changed over the past decades in systematic review conducted by NG Italy. What is obesity? Obesity is a complex disorder involving an excessive amount of body fat. Obesity isn't just a cosmetic concern. It increases your risk of disease and health problems such as heart disease, diabetes, high blood pressure. What are the three types of obesity? Class 1 obesity, body mass index is 30 to less than 35 kg per meter square. Class 2 obesity, body mass index is 35 to 40. And class 3 obesity, morbid obesity, more than 40 kg per meter square. Causes for obesity is inactivity and for sedentary lifestyle and easily taking more calories and unhealthy diet and eating habits. Being overweight increases the chance of developing the common type of diabetes, type 2 diabetes, and this disease make the body not enough insulin, but the cells in the body have become resistant and the action of insulin. So why does it happen? Diabeticity is 21st century pandemic. Diabetes is now the single greatest contributor to chronic disease. Obesity will soon become the leading cause of death. Obesity can alter the nature of type 2 diabetes by virtue of the role of visceral fat and with the pro-inflammatory process and pro-thrombotic, pro-insulin resistance environment. Obesity is one of the major risk factors for the development of both impaired glucose intolerance, prediabetes, type 2 diabetes, and prevalence worldwide drive toward an increased rate of cardiovascular morbidity and mortality. Given the estimation of the WHO recommendation diabetes prevention program with IGT and diabetes and consider risk for development of cardiovascular complications, the development of diabetes should be treated because of potential of reversibility. So, as we know here, upper body visceral obesity can be insulin resistance due to free fatty acids, which making muscle insulin resistance, vasculature increase constriction relaxation, and decrease relaxation, liver increase glucose release, and pancreas increase insulin secretion. Adipose tissue and endocrine cells in health and disease. As we know here, it will cause for us inflammation, atherosclerosis, hypertension, atherogenic dyslipidemia, type 2 diabetes, and thrombosis. This is due to many of adipsin, tumor necrosis factor alpha, CRP, interleukin 6, and angiotensinogen, increased lipoprotein lipase, and cysteine, free fatty acids, leptin, lactate, plasminogen, and decrease adiponectin. Weight loss was associated with increased leptin, decreased inflammatory cytokines, decreased triglycerides, increased DLC cholesterol, and decreased PP, and decreased insulin resistance, decreased glucose, decreased liver fat, and prevent type 2 diabetes. So diseases linked to obesity is diabetes, coronary heart disease, high PP, and stroke, arthritis, GERD, cancer, HCM, infertility, depression, obstructive sleep apnea, gallstones, fatty liver, stress, incontinence, venous ulcers, and sudden death. Heart diseases can be physical complicated of obesity and type 2 diabetes mellitus, hypertension, stroke, cancer, gallbladder stone, obstructive sleep apnea, and reduced fertility. And can cause also psychological complication as emotional distress, discrimination, and social stigmatization. There is underlying defect, insulin resistance, and beta cell dysfunction in pathogenesis, sedentary life, diet, obesity, glucotoxicity, and genetic predisposition, increased free fatty acids. All of these can cause insulin resistance, impaired responsiveness to the insulin, and hyperinsulinemia, normal glucose tolerance, and beta cell dysfunction, impaired insulin production and secretion. Then failure of beta cell to adapt to insulin resistance, causing type 2 diabetes mellitus. And this is the shape of the skin, heloderma suspectum. Physiological functions in incretins and hormones secreted by intestinal endocrine cells in response to nutrient intake, glucose-dependent insulin secretion, postprandial glucagon depression and suppression, and slowing of gastric emptying. Incretin were defined as was observed that orally ingested glucose provoked with higher insulin response than comparable glucose administered IV. This well-described phenomenon is called the incretin effect, and affects accounts about 60% of total insulin release following a meal. So we have GLP-1 and GLP-1 is 30 amino acid peptides synthesized and released by L cells in ileum and colon. Sites of action: pancreatic beta cells, alpha cells, GI tract, and CNS, lung, heart. GIP 20 is 42 amino acids synthesized and released by the stem cells of K cells in jejunum and duodenum, and sites of action: pancreatic beta cells and adipocytes. And this can be shown here by the graph. In this incretin effect is reduced in patients with type 2 diabetes. And here's a summary of incretin action of different target cells and tissues on brain, heart, and gastric emptying, pancreas, and insulin secretions, and liver. Those are the cyclic and relationship high-risk obesities, intermediate and cardiometabolic risk factors. Cardiovascular outcomes as high-risk obesities can cause dysfunctional adipose tissue, and cardiometabolic risk mediators, comorbidities, increased insulin resistance, glucose intolerance, and type 2 diabetes, increased BP, and increased abnormal lipid. And increase in inflammation, endothelial dysfunction, and increase cardiovascular outcomes of cardiovascular events, coronary artery disease, heart failure, arrhythmias, and sudden cardiac death. And here also type 2 diabetes mellitus and cardiovascular disease, fatty liver, kidney disease, gallstones, and edema, sleep apnea, and obesity, hyperventilation syndrome, osteoporosis, back pain, and gouty arthritis. So how can obesity affect the cardiovascular disease? Growing health problem worldwide and associated with increased cardiovascular risk on the hand of obesity itself, and the hand of associated medical conditions like hypertension, diabetes, insulin resistance, and sleep apnea syndrome. Obesity has an important role in atherosclerosis and coronary artery disease. Obesity leads to structural and functional changes of the heart, which cause heart failure and alter myocardial structure, increase the risk for the AF and sudden cardiac death. However, obesity has a protective effect on the clinical outcome of underlying cardiovascular disease. The phenomenon called the obesity paradox. Improved cardiac imaging technique allow the early detection of altered structure and function of the heart in the obese patient. in this review and attempt to summarize the relationship between demonstration in this new technique and the early detection of the treatment and subclinical medical condition, therefore prevention of the cardiovascular disease. And there is central obesity and increased free fatty acids. The tumor necrosis factor alpha resistin adiponectin will decrease and they will cause pro-inflammatory status and oxidative stress reduce in O, nitric oxide availability, atherogenic dyslipidemia, or cause endothelial dysfunction and atherosclerotic plaque and post-thrombotic status. Also, it will cause myocardial fat deposition, insulin resistance, alter metabolic profile, and cardiovascular risk factors. Will increase the autodemand and arrhythmia and autonomic dysfunction and increase the ventricular pressure with the ventricular arrhythmias. The excess of visceral adiposity cause increase in degradation of nitric peptides, which produce the heart condition of volume pressure overload and exert different protective function in heart failure and the natriuretic peptide and the antifibrotic anti-remodeling action. And obesity can cause also venous thrombosis and thromboembolism and pulmonary hypertension. Management and treatment, how is obesity treated? By dietary changes. As you can personally lose weight, well, be individual, and this is reversible process that is lucky for prevention of the disease. So patient and people may benefit from cutting portion sizes or snacks between meals and increase activity. Everyone should go to walking or gym about 30 minutes per day. And behavioral therapies is counseling support group methods such as cognitive behavioral therapy, and they have a role to play in supporting weight loss journey. There is some medications FDA approved for treating obesity include orlistat, phentermine, penphetamine, dietary portion, and the new era of liraglutide, Saxenda, semaglutide, Wegovy, and phentermine topiramate, GLP-1 agonists. And weight loss surgeries, class 3 obesity can do bariatric surgeries like gastric sleeve, gastric band, and gastric bypass, duodenal switch. So prevention, how can I prevent obesity? By easier treat than treating. And once it has taken hold, the body has established a new high set point and will consider the to be new baseline weight. Your body works to modulate your hunger signals and energy expenditure and to maintain the same body mass. So in spite of all of these weight loss intentions, and we can make a small sacrifice. Do you have a daily snack habit or pick me up, such as sugary drink and high calories? Consider this replacing just 150 extra calories. And this will prevent this, it will be offer for us weight loss, as well as add a small activity. Alternatively, consider about 35 minutes per day and shop intentionally, stock your home and with healthy food and save sweets and treats for the special occasions. Whole foods are higher in fiber and lowering glycemic index, so they don't cause blood sugar to spike and drop away. Proceeding snacks, treats, and curative overall wellness, reduce your screen time, go outside and go for a walk and manage your stress and try to get adequate sleep to keep your hormone levels in check. And focus on positive changes and healthy activities rather than how your efforts affect your weight. And thank you for being in this the conference, and thanks for Dr. Ines for that kind of invitation.